Morning, Autumn. Sherry.
Good morning. How are you?
Good morning.
Lisa, you have very bright glasses on this morning. I love it.
Thank you. I was feeling bright today.
Good morning, everybody.
Morning, Arvin. Dan. I know we're hitting right at 9 o'clock, but we'll give a couple of minutes. Morning, Dr. Giron.
Good morning,
I think
Braden.
we've got quorum. I think we have quorum, but we'll give a couple of more minutes here.
Good morning, everyone. It's Commissioner Mosby.
Morning. Autumn, can you take a quick, or Sherry, can you please take a quick head count just to see? It's a relatively short agenda, so I don't want to belabor the point for our guests that are here this morning.
Yeah, I was just looking up participants. I believe 4 is quorum. Is that right, Sherry?
5 is quorum. You do have quorum.
We do have quorum. Okay, well, with that, could one of you two please take roll call and we'll get started.
Sure, I can take roll. Chair Schrag,
Present.
Lisa Ruiz-Lee, Natasha Mosby,
Present.
Dr. Giron,
Present.
Jasmine Cooper, Dr. Durette,
Present.
Arvin Operario,
Present.
and Dan Ficalora.
Present. Good morning.
Yes, we have 6, so we have quorum.
Well, fantastic then. I will call this meeting to order then. Roll call has been completed, excuse me. We'll start off with public comment this morning. Because there's no physical location for this meeting, public testimony under this agenda item may be presented by phone or written comment. Because of the time considerations, each caller offering testimony during this period for public comment will be limited to no more than 2 minutes. To provide testimony by telephone during the period of public comment, members of the public may call at any time after 9 a.m. February 9th. Correction. March 23rd, 2023. Members of the public may also request to be added to the minutes by submitting electronically before, during, or after the meeting to Autumn at the email listed there. You may also mail written documents to the Division of Public and Behavioral Health, 4150 Technology Way, Suite 300, Carson City, Nevada, 89706. So with that being said, do we have anyone for public comment? approve? Seeing and hearing none, we will call out public comment. The next, before we move into possible action, I just want to touch base here. There's two things that I just want to briefly state as we move into, because I think it is kind of related to some of our activities here. The first is, I know we have a lot of testimony going on, and I've had the opportunity to look at and review a number of bills, both public behavioral health related and otherwise. And I just, something struck me as I listened to a couple of pieces of testimony, and that is the need for intellectual honesty when we are testifying and giving opinion and focus, that we ensure that we come from a place that looks to collaboration. We come from a place that really looks to the best interests of the children that are out there. And most importantly, that we look at a space where we are intellectually honest with ourselves and how we represent the opinions, feelings, or actions of others. So that's one. And then the second piece that I think really that, and I'd like to have everyone on this board take a look at, is AB 265. There is, so when you get a chance, please take a look at AB 265 and some of the provisions and actions. There's some recent, and I can send out to Autumn a recent link for the most recent testimony. And I think it would be worthy for those members of the team to take a look at. And I don't think that's going to impact walking quorum, just as to send out a link. So Autumn, yes, you have your hand.
I believe there's one other bill that affects the commission. Fortunately, I'm also a ledge liaison for the division, so let me find it really quick. I believe it's 201.
Okay.
I believe it is, but let me just double check. Yeah, Sherry just confirmed. AB 201 also mentions the Commission on Behavioral Health, so that might be one you might want to look at as well.
Okay. So how about when I send you the link that I have, if you could send out some information to the rest of the team on 201, I think that would be good for everyone. So, okay, then we'll move on to agenda item number 3 for possible action. This is approval of the meeting minutes for the February 9th, 2023 commission meeting. Does anyone have any comments about those meeting minutes? All right. Seeing and hearing none, would anyone like to make a motion for approval of those minutes?
Durette, I'll motion to approve.
All right.
Dr. Giron, I will second that motion.
All right. All in favor of approving the minutes as submitted, say aye. Aye.
Aye.
Aye.
Any nays? Any abstentions? All right. Seeing and hearing none, the minutes have been approved. Next agenda item is agenda item number 4 for possible action. That's the review and revision suggestions and or approval of a letter to the legislator regarding the Regional Behavioral Health Policy Board draft bill requests. I'd like to open it up. I want to first thank Commissioner Mosby for taking the time to do a quick draft summary and to put all this together and in such a short period of time. So Commissioner Mosby, I really appreciate your time, and I know I shared with you offline my appreciation as well. So does anyone have any questions? I know I do, but I don't want to be I don't want to always be first to the table. Does anyone have any questions, concerns, any thoughts related to any of the parts and pieces? Any of the specific bill drafts as they are listed in here?
This is Commissioner Durette. I want to applaud you for having the most succinct, to the point, and focused letter. I think it is one of the best we've ever had and really gets the point across in a way that's very quickly and easily digestible. So thank you.
You're welcome. Thank you. Thank you both.
Yeah, excellent work. Anybody, I have one minor, I don't know if it's a question or concern, and maybe I can, do we have anybody from Clark Regional Policy Board here today?
Yes, hi, Michelle Bennett for the record. I am the coordinator for the Behavioral Health Policy Board.
Okay, I just have a question. I'm wondering if you could help me out. I see that the bill is focused in on affordable housing, which I think is absolutely something we need. But it's my understanding from reviewing some of the testimony that the Clark proposal would give the board both receiving and managing of significant number of funds that seem to kind of deviate from what what policy boards are designed to do. It almost turned it into a fiscal agent, and it doesn't seem to have an oversight component of how the money is spent and who sees it. Would that be correct, Ms. Bennett?
I haven't gotten into the detail about the board, the bill and how it's created. I'm sorry. I do know that they want to assign certain monies to go to each region, and the region would be able to decide on how they would spend that in terms of supportive housing. Valerie's raising her hand. She might have some more information about that.
And then the other question I have is this version that was presented to the legislature, was that in a final approved decision by the board? Meaning, did the current amendments as they're presented, were those done so by the board itself to approve that that measure going up?
There are pending amendments, and that would be approved at an upcoming board meeting.
Okay. All right. Val?
Thank you, Chair. So for the record, Valerie Haskin, Rural Regional Behavioral Health Coordinator. I just wanted to note that the way that the bill was presented to my board was that the regional behavioral health policy boards themselves would not be fiscal agents, but would rather have an opportunity to work on the approval and review committee for grant applications for those funds for each of the specific regions. And then, at least 500,000 of those funds would be held for projects within those regions, but it wouldn't be under the board. That being said, if the bill passes or is going to move forward without language removing the boards as the fiscal agent, I believe that my board would most likely pull their support simply because they have no interest in becoming a fiscal agent. We just don't have the capacity, and I think that they're in line with your comments there.
Okay. Miss Edwards.
Good morning, Chair and Committee, and forgive my voice. I'm recovering from a little something. I would just echo, I'm the Washoe Regional Behavioral Health Coordinator, and just wanted to echo what Coordinator Haskin Val said. Washoe as well initially supported the bill with a letter of support with a lot of questions. So depending on how the amendments roll out, it was our understanding some of the amendments had not been board approved and voted on, which certainly flies in the face of a unanimous board decision. So clarity is going to be sought for sure, but agree with Val's eloquent statement. Thank you.
Okay. I guess for maybe discussion amongst the other commissioners, it calls into a little bit of concern for me that we still have pending. Obviously, if we're going to put our support, we'd want to have it behind a finalized unanimous decision of the board. I'm wondering if at this point, from an amendment standpoint, we would remove the Clark portion and the first item of affordable housing, because it looks like workforce development, staff retention, and the rest are all covered. And then we would remove the first bulleted paragraph of this to move forward at this time. I would hate for us to not put some support behind our policy boards and delay because of some things that are administrative, but that hearing the comments from the other regional policy boards, I would have some hesitation moving forward with the Clark portion if that's the case. I'd like to open it up to discussion, and then I'm not 100% solid in any direction, but I'd like to hear from the rest of the commissioners if you could, please.
Commissioner Ficalora, for the record, it was the Clark board that was not present and did a presentation for us at the last meeting, right? They had, I think Char wasn't able to attend to do the presentation like the other boards did.
That is correct. And Ms. Bennett, could you, is there any more than that you can speak to? Or is that pretty much it? She was just unavailable.
Unfortunately, there was a scheduling conflict. And I know that Sarah Adler is another counterpart for this bill. She is she's been working closely with Char, and she was actually the person who presented to the legislature with her. They partnered up, and they both had a conflict of scheduling at that time.
So maybe we would consider taking our support off of that until they came and talked to our, presented to us, and we were able to ask the questions and flesh these things out.
I think that's a wise decision or a wise recommendation, Dan. Anybody else with some thoughts on this one? Arvin, Lisa, Greg, Natasha?
I agree as well until we get some clarity about the amendments. I think it'd be best to remove that piece until we hear from Clark.
Okay.
Commissioner Operario, for the record, I also agree. I think we need to review, that, and any lingering questions needs to be answered before we put our full support on it. So, thank you.
Okay. Well, it sounds like we're pretty well all, and I can kind of see some noddings that we're pretty much all in agreement maybe on this one. And there's still some questions that need to be answered. So then what I might propose is that we remove the first bulleted item under the first paragraph following the words February 9th, 2023, and remove Clark Regional Behavioral Health Policy Board, SB 68. And then in the second full paragraph, we would remove the words after the words related to, we would remove affordable housing, because that's essentially what the Clark bill focuses in on. And then we would remove the very first paragraph of first bulleted paragraph under that same primary under following the words Nevada citizens.
Yes, and I can make those. This is Commissioner Mosby. I can make those changes. I'm looking at the letter now. So if you would like, I can make those and send it back to the team. Whatever works.
If you could send it to if we're in agreement with that, then just send it to Autumn.
Okay.
And then I'll take care of being the signature after Autumn receives it and verifies that we have to make obviously a motion and approve it. But if that's the case, then we can still move forward with a letter just as long as that's the case and Autumn can verify.
Not a problem.
Okay.
Commissioner Giron, for the record. So Clark County has not, moved anything from our February meeting. They haven't, nothing's changed in this past month. It seems that we should have been updated, or they should have come up with something that we could have attached this letter to this letter and their approval. So is there really no movement right now have they abandoned that bill?
No, I don't believe that they've abandoned it. I just, from my understanding, is there's not been an approval by the board. There's some pending amendments to it, and they've not officially approved it. So it's not been through the board process for unanimous or a vote decision. So at this time, it sounds like that the information that's been pushed up to the legislature has been with perhaps an incomplete approval process up to the legislature.
Dr. Giron, for the record. So that I've been just become more aware of how this legislature works, and I've jumped onto that that website going, holy cow, all these
Yes.
these
Zealous.
meetings. So has there been any hearing or testimony to this SB 68?
There has. There's been some pretty lively discussion during the testimony, both in support and opposition to it. Of chief concern, though, is how the funds are, as I understand it, is how the funds are being received, managed, and then distributed by the policy boards, as we heard from the other two boards. And just a moment, Dorothy, I'll bring you up here next. Then initially that they would have some influence, or at least some discussion on it, but not be the fiscal agent itself. And I think that's one of the issues, is that the policy boards are not comfortable and designed to be the fiscal agent of that. Dorothy, can you maybe speak a little more to Dr. Giron's answer or question?
Hi, Doctor. I was just going to provide some clarity, and pardon me if I'm stating the obvious. So all of the policy boards submitted a bill or a draft. We all got assigned bill numbers, and then we're all assigned, with the exception of the Northern Board bill, which is AB 9. We were all assigned a committee, and all three of those bills have been presented. So the Rural Regional Bill, AB 37, was presented, had fabulous support for that. Our bill, Washoe, AB 69, was presented in education, had great support, and have since had work session, and it was a pass as amended. So we also had an amendment, but the board voted on the context of that amendment. It is not yet written into the bill. That will happen next. So we have, we're in that process of then going to the next house. AB 37, no doubt, will be scheduled very soon for work session. And SB 68, as you said, was heard. And I don't know what will happen there, but the normal progression of things, work session, then moving on to the next house, and that sort of thing. And I will absolutely, as I know Val and Michelle and Sherilyn as well, would be happy to, include you in updates on those bills. I didn't want to be presumptive on something I figured you were probably following anyways, but I absolutely, can forward that. So I just wanted to clarify kind of where we were all at this point in the session.
Thank you, Ms. Edwards. Appreciate it. Well, with that being said, would anybody like to make a motion that we move forward with the letter of support with the adjustments as discussed thus far in our meeting today?
Commissioner Ficalora, for the record, I'll move that we approve the letter with the recommended edits.
And Durette seconds.
All in favor? Aye. Aye.
Aye.
Aye.
Aye.
Any nays? Any abstentions? Then the motion passes that we will approve the letter as amended per discussion. And Ms. Mosby will, as the original author, will make the amendments and share them with Autumn for oversight to ensure that they are done as discussed. And then I will provide signature, and we will have this off to the legislature here in the future. And then, of course, we can always look to Clark to come back, and if there's additional changes that put it to where it needs to be, we can look at a separate letter of support for that at another time. So All right. With that being said, we'll move on to we'll close out agenda item number 4 and move on to agenda item number 5 for possible action, discussion, identification, approval of future agenda items. At this time, does anyone have any additional or future agenda items they'd like to have for consideration? I don't. All right. Seeing and hearing none, we'll move on to agenda item number 6. This is public comment. Again, public comment is limited to 2 minutes, and I will not reread our listing from earlier this morning, but same rules apply. Does anyone have public comment at this time? I see Valerie. Valerie, you have 2 minutes.
Thank you, Chair. Much appreciated. I just wanted to say on behalf of the Rural Regional Behavioral Health Policy Board, thank you for the support for AB 37. We are currently not expecting any conceptual updates. The reason why we haven't been scheduled for a work session yet is I believe this bill is going to be made exempt. So we will not be held to the same time as a lot of other bills. Again, we have so far only received support and no opposition, but if anybody has any comments or opposition, we are of course open to hearing that. Also, my board chair and I had an opportunity to talk to Ms. Frost about AB 265, and we also have some very definite concerns. So I'm very happy that you guys are looking into that. We will also be discussing that bill further at our legislative subcommittee meeting tomorrow afternoon. So again, thank you. We appreciate it, and we hope you all have a fantastic day.
Thank you, Valerie. We appreciate that. Is there anyone else with public comment? All right. Seeing and hearing none, we will close that agenda number 6 and move to agenda item number 7, which is adjournment of the regular session. So thank you all for your time this morning. I appreciate the work that everybody has done in looking at this and the efforts that everybody is doing to support our children, our adults, those impacted by behavioral health crisis and substance abuse issues. I appreciate the work that everybody on this call is doing, both as individuals and I also think it's important in just one last comment here that you know is and I will speak only as myself on this, but I think it's important that when we look at who we are and what we do as a commission, our professional titles and roles, I think, are sometimes can be seen as one-dimensional. That people might look to see us as just a child psychiatrist, just as a chair, just as a insert whatever your title is. And I think it's important that as we look to who we are and what we do, we're also mothers, fathers. Some of us, our children, are impacted by behavioral health needs. And I think that what that allows us to do is take this personal. And I know even for myself, with family members, immediate family members who've had or are experiencing some issues in the behavioral health space, that we are not just looking at these issues when it comes to adults and specifically children, both for quality of care, but continuity of care, just as professionals. We do take it as parents of those impacted. We take it as family members. We listen to the voice and solicit the thoughts of those who are impacted by the decisions we make. And so I want to take that as an opportunity of acknowledgement, that it's not lost on all of us. And just as a reminder too, for those who are listening here today, who may be reviewing these notes later, and to ourselves, that we continue to do that, because at the end of the day, the decisions we make are real. They impact people's lives. And I want to thank the board, the commission, for the great work that you've done in keeping everyone intellectually honest, allowing us to have very frank and open discussions. And I'm excited to see where we're going to continue to be able to go to impact the lives of others in our state. So with that, I will adjourn the regular session, and we have the closed session that will be up next per NRS, and we'll go from there. So we'll take let's take 5 minutes, and we'll reconvene. Thank you, everyone.
Thank you.
Is there a separate link, or is this?
Yeah. Are we in the same Teams room?
We are in the same Teams room, so we will, you can remain here. Anybody else, please step off, and Autumn, actually, disregard. It looks like Autumn has just sent a separate link, so we will close out of this one and jump into the other one.
Thanks.
Thank you very much.
That's good. Thank you.
Thank you, Autumn.